U.S. spends significantly more on healthcare per person as a percentage of its GDP than other high-income nations, yet we continue to get sicker. About 129 million Americans are living with at least one chronic disease, which now drives close to 90% of all healthcare spending, or about 20% of our entire GDP. Healthcare costs are on track to grow from roughly $5.3 trillion today to more than $8 trillion by 2033. While life expectancy declines and nearly half of U.S. adults are worried they won't be able to afford necessary healthcare in 2026. And yet, we've kept nutrition siloed from healthcare solutions. At S2G, we believe food is one of the most powerful tools we have, not just for wellness, but for prevention, treatment, and long-term health. Our healthcare system was built to manage disease, but food has the potential to help turn it into a system that actually builds health. That's why we published a new white paper, The Food is Health Opportunity. It lays out how this sector is evolving, the 7 core market segments we see emerging, and what it will take to integrate food into healthcare at scale. To expand on the paper, we kick off this episode with a conversation between S2G's Sanjeev Krishnan and Dan Ripma to unpack why nutrition is facing an identity crisis, what happens when healthcare collides with the bond market, why food as health needs to be treated as strategic infrastructure, and where we really are on the path toward an integrated food and healthcare system. Then I speak with Sanjeev to understand what this means for investors, how food as health fits into the 5 structural forces shaping today's markets, how capital markets are viewing this space, and where real opportunities are emerging as food and healthcare finally start to converge. This isn't about improving food or improving healthcare. It's about redesigning and synthesizing 2 massive systems before their social and economic costs force the redesign for us.
Dan, welcome to the S2G podcast.
Thanks for having me.
We're here to talk about your white paper, Food is Health. The current title, as we record the podcast, is The Imperative for Integrating Food into Health System. I find this title incredibly underwhelming compared to like the system impact of this current potential future. And then I think it's so, I want to get into this. I think it is so broad. It is such an important topic that I think it almost underwhelms like the systemic issues like national security, bond market, obviously, the health of, lives, where we're going from a food system globally. Like, I think it's like such an I think the last year and a half, it's become part of our nomenclature, but I want to go back to sort of the first principles of this. And I love, and I want to challenge the first sentence. Again, I don't know if that will survive it either, but currently it says nutrition faces an identity crisis. Tell me why you started off the report with that sentence.
I think, over the course of the last 10 years and even longer, you've seen different fads and waves come through nutrition. I mean, for a long time, and we've talked about it, food tech was plant-based protein, and that was kind of all of it. And that you've started to see some advancement beyond that into nutrition and some other areas within ingredient technology and some of the other categories that we invest in. And we've kind of grown up in that food tech space. On the other side of it, in healthcare, I think as we have really invested in that category, it is a very confusing word. And when we're in certain rooms, nutrition and hunger get used synonymously. And I think with drawing out the confusion around nutrition and then defining what we mean as food as health, it's really defining what we believe are the investable categories in the segment and really providing some clarity and distance between what we don't mean and, the other kind of hunger or nutrition that's used in a manner that is, very focused purely on calories and really not on using food and nutrition for the improvement of human health.
The thing I do want to get to is to challenge perhaps a first principles thing. And either you Google it or you chat GPT it these days, but I Googled the Hippocratic Oath. And I, as you know, have this notion of the Hippocratic Oath versus the bond market, and you bring it up in the paper around 2,400 years ago. Um, you know, the fundamental notion, I think, is that the Hippocratic Oath needs to include food and nutrition. And I think we've evolved, and I love how you gave the history of the food system and then the history of the healthcare system and how that's evolved, particularly after World War One and perhaps World War II accelerate. But tell me, your notion of sort of the Hippocratic Oath in simple terms, according to ChatGPT, just to be, this was not a critical thinking thing I did. I'll read it to you. It is the promise by doctors to practice medicine ethically, do no harm, respect patient confidentiality, and act in the best interests of patients. It was attributed to Hippocrates, a Greek physician, 460 to 370 BC. It's no longer used verbatim. Most medical schools have a modern version of it. I don't want to restrict the Hippocratic Oath to physicians even, but one of the things that I found, important in your sort of white paper on this is, we have a disease-centric healthcare system. I don't know if there's a lot of people that would challenge that. I think that's a pretty sort of commonly, you tell me you spend more time in this than I do, but, and, is the disease-centric healthcare system congruent with Hippocratic Oath? In some ways it is, but it stops short, doesn't it?
I think the real challenge is that, what's happened in medicine and healthcare is specialization, specialization, specialization. And I think when you think about the Hippocratic Oath, it's more encompassing of a person's, full health. But, I think most doctors and physicians are very focused on their patients and very focused on doing right by their patients. But it's within the specialty and niche in which they are practicing medicine. And I think from a physician perspective, I think the Hippocratic Oath still stands. I think from a systems perspective, it likely doesn't. And I think that's because the two systems have grown up, separately. And, you're starting to see glimmers of the inclusion of, food and healthcare and other, social determinants of health and, non-medical barriers of health, and really looking at those variables that very much influence a person's health, but aren't necessarily, X disease state or Y disease state. And so from a systems perspective, I think it likely does not, it's not congruent. The Hippocratic Oath is not congruent with the systems itself, even though the physicians and doctors practicing within, I think, likely are.
Yeah, one of the things that I've always been fascinated by is, since we started S2G, is sort of at some point the Hippocratic Oath versus the bond market is going to be a struggle. And if you look at 1,000-year history of the bond market, they tend to win in some way, shape, or form. It could sometimes lead to, revolution. Go ahead.
I think this is really the change that investors need to make, is thinking about human health and food as health as strategic infrastructure and not as a separate play. Because when you really think about it as strategic infrastructure across, some of the things that you brought up earlier, national security and the bond market, focusing in on the bond market, you're seeing a massive growth in the, U.S. healthcare spending. It was $5.3 trillion in 2024, and it's going to add effectively another 3.3 trillion by 2033. So you're seeing a massive growth there. You're not seeing the population fundamentally become healthier. In fact, you're seeing declines in, declines in longevity and still significant growing rates of, disease and cancer. And when you really think about it against the bond market, that increase in expenditure is going to force government to raise more, capital in some form or fashion. And when you think about it on the consumer level, the second for personal bankruptcy in the U.S., healthcare costs is the second reason. The number one leading cause for personal bankruptcy in the U.S. is loss of a job and loss of income. The second is being unable to actually pay your healthcare expenses. So you see it both on a very large federal macro level, but you also see it on a consumer level. And I think food is health in the form and fashion that we're talking about it starts to build the ability for cost avoidance and increase the health of the population and start to chip away at some of those fundamental structural issues. But I think the underpinnings that you have to think about it as a strategic infrastructure. I mean, the biggest driver of healthcare costs in the United States is diet-related chronic disease, and I think there's a lot of numbers out there on that, and it's hard to know exactly what's right or what's closer to right. But it's a massive portion of U.S. healthcare spend, and then when you really bring it down to the community level, and a large part of that healthcare spend is government-sponsored programs, Medicaid, Medicare, the exchange business. You take a look at those populations have a disproportionate amount of diet-related chronic disease, and you're looking at populations that also have food and nutrition insecurity and have a much greater, their kind of population, their environment is largely sugar, wheat, all of the kind of subsidized, crops and foodstuffs that you talk about. And so I think while it's hard to draw an exact number, you can very quickly understand that it is an incredibly important variable or input into this equation.
So I think everyone realizes healthcare liabilities are a problem. I believe they'll affect the fundamental cost of capital for businesses that are unrelated. It'll affect America's risk-free rate and portfolios across the board. And we haven't even started the compounding nature of the liability from we're clearly experiencing it, and then I think you hear sort of folks say, okay, well, you can either curtail the subsidy to curtail the safety net. Do you have a view of that? I mean, that as a theory of change to, appease the bond market or taxpayers or our budget deficits?
I mean, going back to it, I think curtailing the subsidy just doesn't solve the structural problem. And I think without really focusing on that structural problem, you'll continue to have that compounding. I also don't think that these issues are necessarily only relegated to subsidized populations. I mean, you mentioned the cost of business, and I don't know a single business, ourselves included in our portfolio, where healthcare costs aren't starting to push up. And that affects directly the consumer dollar. So I think you're seeing it on non-subsidized populations. I think you're seeing it on subsidized populations. And I think the federal or national, conversation is really around cost and cutting cost and not solving or working to solve kind of fundamental issues that are structural. And, I think it always goes back to short-term versus long-term, but I think we need to start thinking much more on the long-term side of healthcare to really have a handle on that cost of capital and to really build a population that, is producing significant economic value, is healthy.
And I think that, the one other thing that's confounded me, particularly in, sort of political spectrums, and I loved where you went with in the white paper, but it was like one sentence that has really profound implications in terms of policy making, is this notion of pitting solutions for hunger and nutrition against each other. And I've had a lived experience of this by, some of the policy work we do in this sector, and to talk about that a little bit, because I think, this notion of cheap calories versus expensive nutrition, it was a system design. And then if you try to fix it, there are odd political pairings that, sort of, it's not a left-right thing. It's a weird political coalition that kind of defends this notion of hunger versus nutrition? Just maybe talk about that and bring that out.
Yeah, well, I mean, going back years, I think when we were initially in DC, we'd be in a room and we'd be talking about, nutrition for diet related disease. And, they'd be like, oh, like we do this, it's hunger, like it's calories. And be like, no, we're talking about something different. And they're like, no, it's hunger. And then you'd be in another room and they'd be like, oh yeah, you're talking about nutrition, we're talking about nutrition. And when you start to unpack it, they're really talking about hunger. And it's very odd. I think it's a very odd thing to have really two words that have so many different meanings within these different policy groups and nonprofit groups and portfolio companies and investment groups. And so, I think it's not intentionally pitting hunger versus nutrition, but how can you utilize food for nutrition and to mitigate some of these liabilities, both for individual people and on a systems perspective. And I think when you start to try to lay the foundation and build companies that are going to address that problem, you run into a very strong community that really is focused on cheap calories and does not want to have a conversation about nutrition. And there's a lot of we've run into a lot of social challenging of kind of the nutrition thesis in certain rooms. So, I think it's a bit scattered of an answer, but I think that these two things are going to be more and more pitted against each other. I think you're seeing that in DC today with Maha against kind of more of the legacy hunger organizations and policy. And I think that is very well poised to be a major topic of discussion over the next 2 to 4 years. And I think you're going to see a lot of changes there.
So I want to pivot us. We've talked a lot about the problems. And so I think, maybe just talk about, I think you and I spent a lot of time on this. I think you alluded to this earlier, when sort of food tech became protein tech and protein tech got completely kind of over hyped in many ways. We sort of started focusing a lot more on sort of the thesis being food tech is health tech. If you look at the profit pools of the food system versus the profit pools of the healthcare system, they dwarf. It's dramatic, the numbers. And so as a result, this is actually a really interesting thesis. And in 2019, 2020, just talk about what S2G, with a lot of your leadership, Dan, has done in this sort of food and health thesis. Before getting into the 7 specific, I want to get to that second, but just we've been doing it since we started in 2014, but really with a acute focus on food tech is health tech. And then what's been the thesis? We know the problem set, so I don't think we need to spend time, but how have we done in? And we've built over 20 portfolio companies in this space. So there's been a lot of learnings, there's been a lot of successes, there's been, continued momentum for some of these companies, but just curious if you could lay out sort of the framework of how we approach this.
Yeah. So I think setting the foundation, when we were looking at opportunities, because of, you talk about some people are the private sector could just go fix this. And I don't know that I really have a perspective there other than it would be extraordinarily expensive and take a ridiculous amount of capital to be able to go and do that. And I think you're also in a very challenging, highly regulated, federated market where, you need billions of, maybe trillions of investment capital to really take that on from a full private sector. And so our view was to really look at it under 2 lenses. One is the investments we were making that were focused on the consumer side, and the other was focused on the healthcare side. And there's some gradation between those. But when we were taking a more acute focus, I think we've been a food tech investor for a very long time. And, every industry has its own challenges, but one of the things that we did was really focus on healthcare experts, that healthcare entrepreneurs that wanted to bring food into healthcare and find some of those solutions. So that was one of our kind of guiding principles. The second was we were paying very close attention to policy to see if there were green shoots that we could at least go and explore and see if there were real opportunities. And around 2020, we started to see some of those green shoots emerge. Um, and then three, because of our legacy, food tech investments, we had a really good understanding of um, really biology and outcomes and how sophisticated that was becoming, which I think is a component we haven't talked about in this conversation, but I think is really critical in the conversation about human health. And so when we were looking at those kind of three variables, those were or three investment parameters, we were really focused on that when we started to build our portfolio. And I think where that materialized is investing in companies that were taking, food or food derivative product through a consumer healthcare channel, but mainly a healthcare channel, to do some sort of prevention, management, treatment of disease. And we invested in companies that were focused on things like high risk pregnancy and congestive heart failure, all the way to, cancer metabolism and oncology. And how do you utilize, food or foodstuff in this manner? And that really became kind of our main area of investment within the portfolio.
And where are we in this journey? Because I think fundamentally it's okay. Can you provide clinical evidence that this stuff works? We're going to go through the 7 different stuff in a second here. Then that leads to economic value creation, savings for taxpayers or payers, and better patient lives, etc. And then third, there are companies that can extract P&L value, enterprise value that we back. Maybe if you want to break it up, like where are we in the journey of clinical evidence that food is a pillar of healthcare fundamentally, and then economic evidence, and then the value capture for our portfolio companies or other companies that are attacking the first two.
So on clinical evidence, I think we're much further along than people think that we are. Even in very, specific areas, I think our companies and other companies in the market have really done high quality clinical research, randomized clinical trials with, that are blinded and placebo controlled. And so you start to have a good understanding. You can always increase the N and have higher statistical data, but we have a lot of information that is we have a lot of very high quality information that we understand the impact that X will have on Y. But I think that's decoupled both in some of our portfolio, but more broadly the market, from the economic or P&L impact. And I think that's really where a lot of this needs to be focused over the next 2 to 5 years. We have a good understanding of a number of our portfolio companies that are taking these solutions into healthcare and understanding, cost avoidance, like, what is the saving for a health, a payer or health plan for a specific program, and what does that ROI look like? We've done a lot of that work and we have a good sense. And for me, in our portfolio, I think that's the foundation building before you scale a really sizable P&L business that becomes highly valuable. So I think there's work that needs to be done, especially outside of our portfolio, on the economic value. And one of the things that I think we focus on and others should focus on is that payers view all of their populations as unique. And it's honestly similar to a farmer where they're like, this worked on this field, but it's not going to work on that field. Payers, it worked on this population, but it's not going to work on this population. And you get into that same very similar adoption cycle of these solutions. In part, I think that's due to limited work done on really understanding the economics and value creation of these programs for populations. Go ahead.
Yeah, I mean, I wanted to. I think it's also like, if you look at 25% of our GDP, which is, call it 20% healthcare, 5% food. Both those things are biological systems, to your point. Like the human body is a set of 4 systems, at least, if not more. Obviously, food's typically produced with soil. Soil is a huge system. And then, so you have like this layers of complex adaptive systems, which makes, sort of correlation versus causation, like very difficult on like, hey, this intervention helps with this intervention helps with that. Forget adherence, like not everyone's going to eat kale, but you have, the largest singular proportion of GDP in the US being a biological system, healthcare and food. And how, I think, have we seen that this stuff works, that there's clinical evidence, economic evidence, and P&L? I know it's early, but like maybe just for the audience, just like bring it to life a little bit of like what's working that gives us, some perspective on this thesis.
When you look at how we kind of qualify these sectors left to right, I think it's also that quality is also in terms of clinical data and evidence. And so, kind of left to right, and I'll skip some of them, but if you're looking at kind of healthy food, that's a little bit of a better for you, focused on population. And if people are self-selecting to eat better, you have a healthier population. As you go right into supplements, medically tailored meals, medical foods, therapeutics, you start to really increase the quality of clinical data across that. The one call out I'll make is that in the supplement category, while many supplements do not have clinical trials, our strategy there has been to really focus on supplements that do have high quality clinical trials, or that we can launch high quality clinical trials, and in certain cases upgrade them to medical foods and have use cases very specific to healthcare. On the left hand side, and you said this word before, adherence, and I think that word has really influenced the type of company that we're investing in. I think when you just take food to healthcare is there just saying, what do I do with this? Like, they have avenues for their members to go and purchase food or get food, and they're supportive of that. But when we looked at kind of how we were going to allocate our capital into companies, it was bringing joint solutions. So taking, digital health with food to really prove out both the clinical outcomes and the economic value, while very importantly, working to really encourage these members to adhere to the program. And I think that's been a critical difference in our portfolio, where we've been able to drive incredibly high adherence rates. And even within specific portfolio companies, when you look at a population that we worked with last year, sometimes they're still improving in the following year. And those habits and changes, they've really continued. We've seen that in uncontrolled diabetes populations, congestive heart failure populations, orthopedic patients. We've really seen our companies be able to do that. And I think it really comes down to the joint solution, and not just bringing, hey, payer X, here's healthy food that you can figure out how to get to your member.
Yeah. So the clinical evidence is there, the economic evidence is there, and our companies are growing revenue and gross profit, and in some cases, EBITDA.
Mm-hmm.
So I think in the white paper, you do a great job of sort of taking our thesis and then doing portfolio construction around 7 specific genres. I'm going to say the 7 genres and just maybe, go through it at some level of detail. And then we don't have time to go through all 7, but one sort of is healthy meals. The second being sort of functional ingredients. Third is sort of supplements and nutraceuticals. 4, medical food, and maybe defining that for a bit for the audience that may, not think what that is. Food-driven care engagement. Integrated clinical nutrition. And then finally, nutrition-enabled therapeutics. So those are sort of the 7 sort of sub-sectors, if you will, within food is health, as the white paper defines it, and I think how we've defined it. And then maybe just talk about those in some high level.
Perfect. So from left to right on that list, I think it's really two main gradients. One, as I mentioned earlier, is really around clinical evidence and the investment in clinical evidence and the requirement for our investment. And the second is where those are in the market from a channel perspective. So on the left hand side, it's more consumer driven. And on the right hand side, it's more healthcare driven. And one of the things we haven't talked about is that when we think about our overall approach, we do kind of bifurcate between population health and individual health. On a population health, it's really focused on access, affordability, and really trying to find ways that you can provide higher quality protein and produce and meals to any given population. And on individual health, it's very much focused on how do you improve a very specific, disease or cancer using diet and nutrition in one of those manners, whether it's medically tailored meals, integrated clinical nutrition, therapeutics, et cetera. And so on the healthy meal side, this is very much a consumer driven strategy and focused on how do we have it's consumer and healthcare, but more on the consumer side. How do you produce high quality, lower cost meals, and how do you think about the channels and selling that to consumers? And I think we've done a lot of that over the years, and is very much in line with our kind of long term investment strategy. Um, as you go towards supplements, we've focused on kind of unique areas within supplements, and so supplements from a regulatory perspective are you're not able to make strong claims on supplements, and so we're still restricted by that, but we are investing in clinical studies so that one, we actually do have a good understanding of if this product works and to what efficacy does this product work, and we can relay that to the consumer. And I think on the consumer spectrum, you're starting to see consumers really care more and more about the science and clinical evidence. I think you've you kind of see it in a lot of different segments, but whereas like 10 years ago, consumers didn't think much about the clinical evidence and didn't care about it and didn't listen to podcasts about it, they really do anchor their purchasing behavior based on that.
Yeah.
In many cases.
Sanjeev's conversation with Dan helps lay the foundation: why food belongs inside the healthcare system and what's at stake if we don't change course. But once you accept that premise, the next question becomes, what does this actually mean for investors? So now we want to zoom out. If food is a critical part of healthcare and both of those systems are huge economic drivers, how does that reshape the way we think about risk and opportunity? That's what I explored in the following conversation with Sanjeev. Sanjeev, welcome back to the podcast. Thanks for joining again. On the last conversation, you had a chance to talk to Dan and went pretty deep into the why behind food as health, really including the current state of our healthcare system, the bond market implications, tension between this disease-centric healthcare model that we have now and really the spirit of the Hippocratic Oath, and the idea that food and health should be treated as a strategic infrastructure investment. It was a really powerful way to frame up how big and interconnected this issue really is. And today I want to sort of build on that and shift us into more of the investment opportunity and how you see that taking shape. So would love to start by talking a little bit more about how you see food as health fitting into your point of view on the age of adaptation and those 5 forces that are driving the current market. Can you tell us more about how this fits in?
Yeah, so as you know very well, I think we're anchored S2G around sort of 5 structural forces, which we think are shaping the future of demand and supply, of cap allocation of both beta and alpha. And although this is sort of relegated to a corner of the food system and a corner of the healthcare system, I actually think it has prominence across those 5 forces. And as a reminder, is the 5 forces are sort of CPU to GPU, sort of shorthand for AI. 2, and declining price of money to an unknown price of money. 3, sort of unipolarity, multipolarity. 4, sort of 1.5 to 2 degrees or higher. And then 5, aging and a demographic headwind to a demographic tailwind. Obviously, aging is a clear sort of structural secular issue that drives, I think, how do you healthy aging, um, given both the contingent liabilities that aging has on the balance sheets of most sovereigns and most companies, most pension funds, insurance companies, etc. But I also think it goes to sort of this unknown price of money, just given, particularly in the US, is 20% of GDP. It's a significant driver of debt and deficits. And so we have to figure out how to lower the price of healthcare. And I think food as health is a clear pillar, in my opinion, to driving that. As sort of the 1.5 2 degrees, there's going to be pockets of the world where, particularly, you know, public health and heating are going to be a greater prominence, for sure. I think the unipolarity, multipolarity, I think what we have done, particularly Brazil, perhaps China, is effectively many of them have colonized the US food system. And so you're seeing greater rates of cancer, greater rates of sort of metabolic disease states. So it's not just a US phenomenon anymore. Um, Food and health are, and I think people talk about food security a lot, but I think I would say, life expectancy um, as a as a key pillar is going to be an important one. And so I think there is a geopolitical dimension to this, I would argue.
Mm-hmm.
And then most fundamentally, if you think about, the thesis on AI that I hear most about is global GDP's 100 trillion, software is call it anywhere from 2.5 to 3 trillion. Services is anywhere from 20 to 30 trillion. And the whole notion of why we're raising so much money for power, infrastructure, compute, models, and applications is to automate a lot of these. And medical services is clearly one of them, but R&D and the notion of how do you do this. So I think, although this seems like a niche issue, I think it's so central, to these five forces. And really, at the end of the day, how do you get patients better quality and less disease and more preventative? And then two, how do you get payers more value for their money, whether taxpayers or the bond
Yeah.
market? So I think it's really a really important thing that needs to be mainstreamed a lot more.
This topic is clearly at the core of the age of adaptation and those five forces. But how do you think food and agriculture investors view this? How does this fit in the landscape of the food and ag investment and maybe across investment, types? Tell us your perspective on that.
Yeah. So when we started S2G, um, the first sector we focused on was food and agriculture. And the thesis was really in 2013, 2014 that the consumer was changing the food system, pretty much for the first time since World War II. And they were doing it. There was, um, millennials were coming into the labor force. They were voting with their dollar very differently around how they were buying food, and it impacted brands, supply chains, etc. To me, we invested across that system based on that. Consumer was driving change. I think this not only puts the consumer um, at, but you potentially have a new ally, which is the payer class of the healthcare system. So if you combine 20% of GDP around food as one pillar, it's not a silver bullet by any means. It provides an additional tailwind to getting the food system to be anchored around the price of healthcare and lowering the price of healthcare. And I think that is a powerful pillar to be aligned with if we can align incentives that way. And I see it's a matter of when and not if
Mm-hmm.
it's going to be aligned. The other thing you're seeing, I think, is going into COVID, um, in the majority of uh, sort of the grocery aisles, the incumbent was losing market share. And then COVID occurred, and then we focused more on surety of supply,
Mm-hmm.
and it gave a big bump to sort of the incumbents in the food system. Since 2021, that has starting to reverse in terms of volume growth is either flat or declining in many of those categories. And so emergent players are suddenly taking share, and incumbents are losing share. And you're seeing some corporate activity among large players that testify to that notion of this. I don't think many of those incumbent players are even ready for the opportunity and the risk that if you have clinical data equal economic data, then that improves patient efficacy and payer efficacy, if you will, whether it's the taxpayer or the bond market or the employer-based system. The opportunity this sits now. I think for the most part, a lot of food and ag investors are in show me territory. Prove to me that the Venn diagram hits here. But the companies, whether it's in our portfolio or others, that show that this is good for the consumer, good for the payer, and good for the standard of care. Those are the companies I think can scale and actually build more durable moats than just a brand story.
Are these private market investment opportunities still at the venture stage, or how do you see the opportunity spectrum across the asset allocation stack?
Yeah, I think it's very compelling for venture stage companies, growth stage companies, and even middle market buyout. I think there's a lot of opportunity to back healthy aging, back food as health companies that may not show up like the definition of food as health is going to be more, I think, broader than what we're saying. And there's also the opportunity to take healthcare companies and get them involved in food as health. And we're doing some of that work. I think others are doing so across, the spectrum of stage of company.
How are the capital markets going to view this opportunity in your mind?
I mean, I think that is, if you think about allocating to food, it was seen as a durable dividend stock that had a lot of defensiveness. And as the consumer and potentially now other players, whether it's payers or providers, sort of look at that and say there's externalities that are more, getting priced in from the healthcare side. I think you've got to look and say, hey, are these, durable defensive stocks the same, or should I look at sort of emerging players, particularly in the brand side? But I think some of these companies can obviously show interesting moats beyond a brand, whether you're in medical food, um, functional ingredients, nutrition-enabled therapeutics, sort of integrated clinical engagement by nutrition. A lot of the categories we outline in the report, um, as those companies grow, they can take profit pools from healthcare and they take profit pools from traditional big food and get allocated to it. So I think whether you're a public market investor trying to find, a long thesis allocating to the food sector, or you're a private market investor and you want more exposure to this theme of that convergence of 20% GDP and call it 5% GDP. I think there's compelling opportunities on both sides.
For all of our investors that might be listening, if they are looking to allocate more capital to this space, what should they be looking for?
I think, we've thought a lot, both in the report and in this podcast, about the why. From a macro perspective, I think the next step is really show me the data, show me the economic savings, and show me the P&L. And so I think this needs to be brought to life with specific case studies of opportunities that really go from the macro to the micro.
Luckily, we've covered a lot of those throughout our portfolio, and you can find them in our report. So hopefully our listeners will dig in to find some more of those examples. But thank you so much, Sanjeev, for taking the additional time and framing this up from an investor perspective. Appreciate it.
Thank you. Super excited about the report, and hopefully people get to read it in detail and give us feedback.